Hello, everyone. Thank you for joining me today and welcome back to my channel. Today, the topic of my discussion is the personal statement. As we all know, during the medical residency application, if you're applying for Canada or states, it's always important that you provide a personal statement. So, today I'm going to discuss how you can make your personal statement very personal to you, and I will be sharing some of the tips and tricks which I used during my application to get a successful candidate in MLPIMG application. At this point of time, I would say only one thing to you: it's your personal story. Your unique stories and your own experience should be reflected in that personal statement. Don't worry what your experience is, what kind of things you have done in your experience, what kind of skills you have gained. Every skills will give you a unique kind of personality, and that will make you different from all the other candidates. So I feel like when you are writing your personal statement, you need to make sure that you are trying to reflect on your own journey, on your own self. It's something where you have to take some time, take rest, find out what are the things which you can write about yourself, which are best for you. Write down on a paper and then try to elaborate those things in your personal statement. That would really make you feel that yes, whatever is written in your statement, whoever is reading this will know who you are as a person. So let's begin with the videos and see what are the things you can get help from this video. Number one question is always there: how many words should I write? What are the average number, or what are the best number where you can write? If your program is allowing you 1000 words, you can write from 500 to 999 words. It's always your level of expression and your vocabulary, that how many you need to know, or how many a person who is reading need to know. What I mean by that is, if you are applying for a program that allows you maximum number of xyz, let's suppose 500, 600, 10, maybe 900, maybe 1000, so you have to pick a number that, okay, is it a good idea for me to express myself in the limited number, or I can go to the maximum, because they have given you a one window period. They don't say that, okay, if I'm giving you 1000, you have to be inside the 500. No, they have given you the maximum number, the minimum you can choose on your own. So let's suppose if your English level is very superior to other candidates, you feel you can write your personal statement in 600 words, and you can still express the same level of thing which an average English language person can write in 900 words. I would say on my side, when I was applying for MLPIMG, we had a maximum of 1000 words, and I used 999 words, and I got the program. So there is no way that you cannot go to the maximum. It's really up to your own decision and your own level of expression. So if you are choosing 500 but your personal statement is very beautiful, everybody can see that what is reflecting, how a person can be reflected, absolutely you can go for 500. But if you are a person who can try your best to express as many as things you want, which are very important to you, then I believe 900 words or 800 to 900 words would be a great idea for you. How many paragraphs? That's the second important questions which I have heard from many people. At least 3 paragraphs. What do I mean by that is, at least 3 paragraph means first your introduction, what your things you want to show them. Second, your unique story, which can be your skills, which can be your experience, which can be your previous experience, in a way that can show them that what kind of skills you have gained from that, or what kind of skills you have developed from that. Third one is the conclusion, which is a very important part, because most of the time first and last things are always read by everybody, because they want to know what your conclusions and what your introduction look like. So at least 3 paragraph minimum, you should go with that. But you can increase the number of paragraphs if you feel you have a lot to express and you feel that 3 paragraphs are very minimal number for me to share my story, then you can go for 5, 6. I would say for my personal statement for MLPIMG, and I am a successful candidate, so I feel like I have given my 6 paragraph. Before making this video, I went back to my application. I make sure that I'm not giving you a wrong number, and to be honest, I have given 6 paragraphs. First was the introduction, last was the conclusion, but the 4 middle paragraph was my unique story, was my skills, and the things which I wanted to share with them so they know that why I'm fit for the MLPIMG program. So in this case, number of paragraph, it's your own choice. Between 3 to 6 is a very good number, but I'm including in 3 to 6 is your introduction and your conclusion. So make sure if you are writing 5 paragraphs, your first is the introduction, last is the conclusion, but you still have a bracket of 3 numbers where you can share your stories in different paragraphs. There are many different things which you will learn and which you will hear from people around you, that personal statement should be like this, personal statement should be like this. But in my own opinion, I would say there is no right and wrong way of expressing your interest into the specific program, but few tips can really alleviate your profile in front of the program selector faculty. So you need to check. Number one, you need to go and check back to the description of the program and to find out what are they looking for in a candidate, what are their own goals. Because let's suppose if you are going in a family medicine specialty and you feel don't comfortable in talking to a pediatric specialty, then you will be not good for them, because family medicine means you are talking to all ages people. Either the patient is 90 years old with dementia and delirium, either the patient is 9 months old who cannot speak. You have a capability to deal all of these things. So their goal is they are looking for a person who can overall talk to anyone and everyone when it comes to the providing care. So make sure you check your program description and find out what their goals are and how you can fit your expertise into that goal and align with them to get a successful future for the patients. Second thing, I can give you an example to make it more clarify. Let's suppose if you are talking about a return of service for MLPIMG, as I mentioned in the previous video, what the return of service is, what are the things are specified in the return of service. It was very brief, but if you don't know about it, you can go back and check out my video regarding MLPIMG application, and you will find a little bit about return of service. So in return of service, they are looking that you can work in a small community or town with limited resources. I'm not just talking about the limited resources into the hospital facility or into the inside the primary care, also outside the primary. That means your own personal life will be surrounded by the limited resources. Your own family will be living in a limited resources sometimes, and a small number of team will be working in that hospital, in that community center. In that case, they are looking for 3 different criteria in a person which can give them a check mark. Okay, this person can really fit in our region or in this specific town. Number one, you should be a teamwork person. If you are not a teamwork person and you are working in a small team, it would be a very huge difference for you to adjust. And that's why if you are a teamwork, if you are a team member person, you can work under a leadership. That's a great opportunity for you to express yourself into the teamwork, and that's very important that you can show it into your resume or in your personal statement. Second thing is leadership. Definitely, if we say that okay, you are working in a team of 5 people, there are 3 nursing staff, one health aides person, and you are the 5th person. So here you are the superior person in terms of talking to them and and giving them suggestions that how they can improve or how as a team you can improve. So here comes your leadership qualities. This is the very important quality when you are working as a single doctor in any community, or you are working in a place where at some point of time you are the only person who can decide what to do for the next in the whole team. So that's why that's the comes where leadership qualities are very important. But it doesn't mean that you show okay, I am a leader but I cannot work under a team. Yes, you have to be laterally working in both things. Either it's give you an opportunity to work as a leader and guide your team, or let's take them with you. The second thing, you can obey the orders, or you can get the suggestion from your superior, from your leader, and try to follow that in a very good manner. So both qualities they are looking for, because situation dependent you have to switch your role or your skills. So you can write that part, and that's the one thing which MLPIMG always look for during the return of service, and that's why they look for something, a candidate who can be successfully completing their training and then going back to the community and serving them. Third thing, you can adjust to move forward to provide care with the limited resources. I haven't mentioned here about the personal, because definitely first of all their target is to look for professional side, then they look for the personal side. When you will be working, when you will be doing an interview, which is the interview with the sponsors, like second interview, they will ask you how you can feel yourself to be living in a limited resources with your family, and how you can feel comfortable and enjoyable. That means if you are in a community for 4 years and you say, oh, there is no way I can get the shopping mall, but I can still try to enjoy with my family in different ways, which are the resources available. So that's why that's a personal story. But if you talk about the limited resources into the community, in the community health center, in the hospital where you're working, are you able to move forward and provide the care, rather than thinking, oh, I don't have this, so I cannot provide care, I don't have a staff, so I cannot provide the care to the patient. So that's the one thing they are looking for as well. This is the one thing which is very important. Either you write your personal statement, either you write her resume, either you write your CV, anything, your grammars and sentences. It is very important that you ask for help from in this section if you feel to do so. That means if you feel that your grammar, your English language is not your first language and you want to take help, you can ask from anybody. It doesn't mean that the person should be from medical, it can be from non-medical person, and then they can give you a very good help in terms of grammar and what your sentences look like. What your sentences look like means, is your sentences making sense in terms of what you are trying to say, or it really doesn't feel the comfortable way. There's someone who doesn't know you can really understand what you are talking about. One of my mentee had given me a very good tip, and I believe it's very helpful to me lifelong. When you are using the word and, when you are using the word and between anything, make sure you use between words, not sentences. If you are giving an example, I do have a quality of teamwork, leadership, and good communicator, that looks fine. But if you talk about first sentence, I am having a very good leadership qualities, for example, this, and I am a very good communicator, example, this. So that and comes in between the sentences. That's not good. Try to break down that sentence if you need to write the word and. This is the one tip which I have taken as a permanent for myself, whenever I'm writing something. So that's the one thing. And last but not the least, it is not important that you write a fancy personal statement. You can write a simple personal statement which anybody can feel that this personal statement makes sense to me. You don't have to write a very good fancy vocabulary. Whatever the levels you feel comfortable, let's go for it. But if you feel there is a word which is very right at this point, then don't hesitate to use it. If you find, oh, this is the very good word for my story, and you can put this word and make the sentence very beautiful, you can try to use it, and you can definitely go for it. But don't think that your personal statement should be fancy with the high level vocabulary. It can be a medium vocabulary. Sometimes you can use some of the words which are not familiar to you, but during the personal statement you figure out these words can be used, so you can go for it. How you can portray your paragraph. Now the next topic of is, what are the paragraphs looks like, and how you can say, okay, I do have option of 5 paragraphs, I have to write something. What are the things you have to mention into the paragraph from your own unique experiences? This is the picture which I have taken from CARMS. I believe everybody is familiar with this picture. So they are talking about a person into the professional life having most of the qualities which are written on the slides: professionalism, communicator, collaborator, leader, health educator, scholar, and medical expert. Medical expert is our own knowledge. We should know what kind of conditions are coming, how we can treat, and everything. But other fives are that will be developed at some point in you, or that was already built in when you are being in a medical school. Professionalism is very important in our field, so make sure you write everything in a way that looks professional, that sounds professional, and your behavior should reflect in a professional manner. Communication is a very important. Communication doesn't mean that only we are talking about the communications between the patients and the doctor. It is the communication between everybody, your colleagues, your team members, your hospital admins, patients. This communication would not just be verbally, it could be non-verbal communication, the behavior you are talking, the gesture you are trying to say. So these are all the things which are very important. Collaborator means a very good team member who can collaborate with everybody and anybody to provide the best care to the patients and to work for the future betterment. So that means you should be a collaborator, and you can, and I'm sure that everybody who have worked in the past, they might be working at some point to working with a team and collaborating with many peoples to make sure that they can give their best in that position. So you can express that with an example in your own personal statement. Leadership qualities, as I mentioned above, it's sometimes very important for people to have a quality of leader, because that will help them to navigate as a team, and that will sometimes guide them to find out what goes wrong and how they can make it better. Health advocacy, it is also an important part, because we don't just talk about treating patients, we have to educate them, we have to educate our colleagues, we have to give some advices or suggestion at some point of time. Scholar is also one of them. So these are all the qualities as a CanMed role they are talking about. If you have like 4 of the qualities which you can pick and try to get your own examples into the personal statement, that would be a great. In my own personal statement, I did have my unique experience in terms of showing, but I feel like the experience which I showed was the communication in a very nice brief example, and I showed a collaboration along with the health educator. That means if you are trying to go outside the community hospital and you are trying to collaborating with someone to provide a health advocacy in the community, that will also reflect your 2 of your CanMed roles into the one place. So try to figure out what are things unique to you in all of this list, and what are the things you can pick where you have a best example of your real time scenario that you can put into the personal statement. This is the one thing which I always feel, that my successful story is not just because I worked hard only, or I took mentorship from the peoples, or my profile was very good enough to say no. I would say my resume, my personal statement, and my interview, all of these things was compiling and telling me who I am. There was no different way to say. My personal statement was written by some other person, CV was written by some other person, and interview was given by me, that was a very different person. No, I had made everything by myself. Definitely, I took a lot of mentorships. I asked help from many people who were of my same level. IMGs, I have talked to many successful IMGs. I have talked to non-medical people. I have took help from my friends, families, the people who are around me, who I can know that they can give me the best advice. I have taken help from many organizations which help them, maybe some paid or non-paid. But at the end of the day, when I see any of this step, I would say yes, this is me. I am the real person who is telling it, and I am the person who is telling my true story. I'm not trying to make anything which doesn't reflect me. I won't say it's a fake. You can try to modify things which can be best for you, but at some point of time it should reflect. When you read your personal statement after 6 years, it still tells you the level when you started making it and the level when you were. It doesn't show, oh, I don't know this person, who's this person. Like, I cannot say myself I was this person. Don't degrade your personal statement, but don't make your personal statement which doesn't make you reflecting. So polish each of this application step. I would say not just CV, not just personal statement, as well as your interview. So make your own, so program admin can see you truly even without meeting you in person, because till the interview finish nobody meets you, nobody know who you are. Still they can see, okay, I know this person who mentioned this thing in their personal statement, and they are talking very relatable to the answers into the interview. That means I'm talking to the same person. So these are all the things which I feel very important, and I believe I tried my best to give you all the tips and tricks for the personal statement. You can ask for help from anybody who you feel that they can help you in the personal statement. But before you submit your application, read your personal statement in a very calm environment and when you are very fresh, to see, is it looking to you, is it talking to a person who is very familiar to you, or is there anything which is missing or which is very much in your personal statement. So that will really help you to boost your confidence, and that will get you a success into the personal statement as well as in your whole application to get the spot into the residency. Thank you so much for listening to me. If you have any question, you can give your comment. Please, if you like this video, make sure you share it and let me know what the next topic you're looking for. Thank you so much.